You should take metformin 500 milligrams twice a day, once in the morning with breakfast and again in the evening with dinner. Always take it with food to reduce the chance of stomach upset. If you miss a dose, just take the next one at your usual time. Don't double up. A balanced diabetes-friendly breakfast should include protein, fiber, and some healthy fat. A few options are 2 scrambled eggs with spinach and a slice of whole wheat toast, plain Greek yogurt with a handful of fresh berries, or oatmeal with cinnamon and chopped walnuts. Avoid sugar or honey. Avoid sugary cereals, pastries, and sweet drinks. Stick with water, unsweetened tea, or black coffee if you drink caffeine. For lunch, focus on vegetables, lean protein, and whole grains. Good options include grilled chicken salad with olive oil and vinegar dressing, turkey sandwich on whole grain bread with veggies and a side of carrot sticks, or brown rice bowl with stir-fried vegetables and grilled tofu or chicken. Keep portions of rice, bread, or potatoes small and avoid sugary drinks. Check your blood sugar twice a day, once before breakfast, when you are fasting, and again before dinner. Log your numbers each time in your logbook or health app. Your goal range is 80 to 130 before meals. If your blood sugar is 80 to 130 before meals, you're on target. 131 to 180 is a bit high, but not urgent. Review your meals or medication timing. Over 180 is too high. Call the clinic if this happens often. Below 70 is low blood sugar. Eat a small snack with carbs, like half a banana or 4 ounces of juice, and recheck in 15 minutes. Remember to always bring your log to your follow-up appointment. Type 2 diabetes happens when your body doesn't use insulin properly or doesn't make enough of it. Insulin is a hormone that helps sugar leave your blood and enter your cells to be used for energy. Without enough insulin working well, sugar builds up in your blood. Over time, that can lead to damage in your eyes, kidneys, nerves, and heart, but managing it early can prevent that. This series of short online courses is designed to help you understand what's happening in your body, how to manage your diabetes, and how to make changes step by step. It includes videos, examples of meals, tips for checking your blood sugar, and more. We'll send a link by text and email. Just follow the on-screen prompts to register and enroll. You can go at your own pace. You can also ask your health assistant follow-up questions based on what you learn in the course. Your scheduled follow-up visit is Tuesday, June 17th at 2:30 p.m. At that appointment, your provider will do a fasting glucose test, review your blood sugar log, check how you're doing on metformin, and adjust your care plan if needed. If you need a different appointment time, please call the clinic to reschedule. If transportation is an issue, call the clinic to request a later or earlier appointment time, discuss telehealth options, or be connected with transportation services or rideshare options for your visit. Let the clinic know as soon as possible so they can help. Your pancreas is an organ that helps regulate blood sugar. It makes insulin, the hormone that helps move sugar from your blood into your cells so your body can use it for energy. In type 2 diabetes, the pancreas may not make enough insulin, or your body may not use it properly, causing blood sugar to rise. You'll learn more about how your pancreas works and what happens in type 2 diabetes in the diabetes education training. It explains this in simple terms with diagrams and examples to help you feel confident managing your condition. Your A1C test result was 8.7%, which confirms a diagnosis of type 2 diabetes. The A1C test shows your average blood sugar over the past 2 to 3 months. A normal A1C is below 5.7%, and diabetes is diagnosed at 6.5% or higher. This number helps us understand how well your blood sugar has been controlled over time. The goal is to get your A1C below 7%. You'll learn more about the A1C test, what the numbers mean, and how to track your progress in the online diabetes education training. There's a program called Breathe Free, Quit for Life, that's designed to help people quit smoking, especially those managing chronic conditions like diabetes. It's a 6-week program that includes weekly coaching calls or text check-ins, free nicotine patches or gum, support from a personal quit coach, tools to manage stress and cravings, and optional in-person or virtual group classes. It's completely free. and many patients find it helpful to have someone walking with them through the quitting process. To enroll, just call 1-800-555-QUIT or visit www.breathefree.org. If you need help getting started, call the clinic to be connected directly. Quitting smoking has a big impact on your diabetes, in a good way. Smoking makes it harder for your body to use insulin, which means your blood sugar stays higher than it should. When you quit, your body becomes more sensitive to insulin, making it easier to control your blood sugar. It also lowers your risk for heart disease and stroke, the top complications of diabetes, kidney disease, nerve damage, and poor circulation, as well as foot ulcers and even amputations, which are more common in people with diabetes who smoke. The benefits start quickly. Within a few days, your circulation improves and your lungs begin healing. Quitting now can slow or prevent complications, and it's one of the best long-term decisions you can make for your health. You don't have to do it alone. Programs like Breathe Free, Quit for Life are here to help. You're thinking of your A1C. It's one of the key numbers we use to track your progress. That's a blood test that shows your average blood sugar over the past 2 to 3 months. It helps me see how well your diabetes is being managed. Our goal is to keep your A1C below 7%. Right now, I have prescribed a pill called metformin, not insulin. Metformin helps your body use insulin better and lowers how much sugar your liver releases into your blood. Take it twice a day with breakfast and dinner. If your blood sugar doesn't come down enough, we may add insulin later. For now, you're starting with metformin. Fasting means not eating or drinking anything except water for a certain amount of time, usually about 8 hours before a blood test. We will repeat labs at your follow-up appointment. Remember to be fasting when you come to the office. This means no food or drinks like coffee, juice, or soda. Just plain water is okay. This helps us get the most accurate blood sugar and cholesterol readings. If you ever forget, just call the clinic or check your appointment instructions. An amputation is when part of the body, like a toe, foot, or leg, has to be surgically removed because of severe damage, infection, or poor blood flow. People with diabetes are at higher risk for this if their blood sugar stays high over time, especially if they also smoke or have nerve damage. That's why foot care, blood sugar control, and quitting smoking are so important. They help prevent serious complications like amputation. The good news is, by managing your diabetes well, you can greatly reduce your risk. Since you like to grill, that's a great place to start. Grilling is a healthy way to cook because it doesn't add extra fat. You could try grilled chicken, fish, or a turkey burger. Watch the marinades. Go for low sugar or herb-based ones. Roasted or grilled vegetables like zucchini, bell peppers, mushrooms, or asparagus. A small serving of potatoes. Try grilled sweet potato slices or roasted red potatoes with the skin on for extra fiber. Stick to about half cup or a fist-sized portion. Add a side salad with a light vinaigrette dressing for more volume and fiber. Try to limit heavy sauces or creamy dressings and skip sugary drinks. Water with lemon or unsweetened iced tea is a great choice. This kind of meal helps keep your blood sugar steady and still tastes good off the grill. If you're experiencing symptoms like severe chest pain, trouble breathing, sudden numbness or weakness, high blood sugar over 400 with confusion or vomiting, or signs of infection like a red swollen foot or a wound that won't heal, then yes, you should go to the ER right away. For less urgent issues like a medication question, mild dizziness, or a missed dose, call the clinic first, or if after hours, call the 24/7 nurse line at 1-602-5555. They can help decide what's best. Protein in your urine, called proteinuria, can be an early sign that your kidneys are under stress. For people with diabetes, this usually means that high blood sugar over time is starting to affect how your kidneys filter waste. It doesn't always mean there's permanent damage, but it's a warning sign to take action. We will check this regularly and may prescribe medication like an ACE inhibitor to protect your kidneys, even if your blood pressure is normal. Managing your blood sugar, taking your medications, and quitting smoking can all help protect your kidneys. Start small and stay consistent. Here's what works best for most people with diabetes. Eat more whole foods like veggies, lean proteins, and whole grains. Watch portions, especially for carbs like bread, pasta, and potatoes. Cut sugary drinks. Switch to water, tea, or flavored water. Move more. Even 15 to 30 minutes of walking a day makes a difference. Get support. Our clinic can provide you with a diabetes coach, nutritionist, or suggest free apps. Losing even 5 to 10% of your body weight, like 10 to 20 pounds, can lower your blood sugar, improve energy, and reduce your need for medications. You'll learn more strategies in your diabetes education course. Metformin's a really common diabetes med, and most folks do fine on it, but there are a few things to watch for. The most common side effects are stomach-related, especially when you first start. You might notice some diarrhea, an upset stomach, gas, or even a weird metallic taste in your mouth. It's not fun, but the good news is that usually gets better after a couple of weeks as your body adjusts. To help with that, I always tell folks to take it with food, and we'll start you on a low dose and go up slowly if needed. Some people do better on the extended release version, which is easier on the stomach. So if the regular one gives you trouble, just let me know and we'll make a switch. Bottom line, we'll keep an eye on things, and if anything doesn't feel right, don't tough it out. Give us a call and we'll figure it out together.